Taxi drivers protesting here at leaders, but I haven't fully studied the roadmap. But I really want to know what's the strategy. And I think the people out there want to know what the strategy is. And in particular, I want to ask, a lot of people who are specialists in public health, immunology, infectious diseases and so on, are saying we should be pursuing a zero COVID strategy, as against what appears to be, in this plan, a sort of roller coaster strategy of up and down, up and down, up and down, and nobody knows where quite it ends. So have the subcommittee considered the zero COVID strategy, which I want to stress is not about returns to lockdowns. It is precisely about returning to normality by putting certain resources and systems in place, in particular the tracing and the testing and tracing regime, so we can really chase the virus and isolate it. That is, if you like, a clear objective which the people can get behind and understand where we're heading. And indeed, connected to that is also the question of permanent healthcare capacity, and indeed the capacity of testing and tracing has a lot to do with permanent recruitment. I mean, a lot of the tracing and testing people were redeployed from elsewhere. What are the numbers that you envisage to be recruited permanently to be employed in testing and tracing to get to the state-of-the-art testing and tracing regime? What are the plans in terms of permanent increases in capacity for ICU and the health service generally in terms of recruitment, because it's people trained that you need? And in terms of public health restrictions, wouldn't it be best to have a hotline for workers in employment where they're worried about encroachment on health and safety guidelines and so on, so that they actually have a place to report to the HSE and a system that is responsive?
On the mask, let's give the people of Ireland credit. Everyone talks about confusion in here. There was no confusion among the people when we brought in regulations to have masks in public transport and masks in shops. And I pushed hard as Taoiseach to make that happen. 90% compliance. 16% were wearing masks last April. 90% compliance. And that's the answer to the far right. I agree with most of what you said in terms of the far right. Government has nothing to do with it, but what they're doing is wrong, and it's wrong. Deputy Boyd Barrett raised the issue of the zero COVID strategy. That is not our position. We don't agree with that strategy, and it does involve severe lockdowns. Let's not pretend it doesn't. It does. The Chief Medical Officer is very clear that that's not, in his view or NIFI's view, a realistic approach or strategy to take. Our strategy is to live with COVID and to maintain, to keep people safe, protect health, maintain economic resilience, jobs, restore public services in terms of getting our schools open and keeping them open, creches, higher education, restoring health services, and in addition to that then quality of life issues around the arts, around sports, trying to keep the games going and live performance as best we can within restrictions, supporting community well-being on the ground and supporting mental health as well, which is very critical and I think is going to become an increasing issue as the pandemic continues and evolves. Lab capacity is the issue, deputies, in the testing. The numbers in the plan are around overall about 3,000 to be employed in terms of the testing issue between those swabbers and contact tracers, and of course many more behind the scenes who would help to administer and do all our work. There is a clinical need for the call one in terms of giving people the results. That is, public health are insisting on that. I take Deputy Kelly's point, and I've made this point to the HSE that we need a permanent workforce, not to be deploying people from in, but that's how it started out. It came from a very low base initially when the pandemic started, and I've consistently made that point. That is what is happening now, and recruitment is underway in terms of more and more people to come into the contact tracing side in particular. In terms of the elderly, it has been elderly proofed, and we respect the elderly in the sense that they've been arguably the cohort of people who have adhered most to the guidelines that have been issued by the Public Health. And also in terms of the advice from NPHET at this stage was to encourage people in Dublin not to travel outside Dublin if possible. That was the advice, okay? That's it. That's what NPHET have said at this stage. And in terms of the COVID committee and the health committee, the difference is clear. COVID committee is all aspects of COVID. That's why the Minister for Finance, the Minister for Public Expenditure attend COVID, along with the Minister for Health, the three leaders and their advisors, because it's exclusively, on COVID, but all aspects of COVID, and would have coordinated the plan that was published today. The Health Committee is dealing with the broader health issues and the health, the winter initiative, but also the broader issues of screening and so on, and health capacity. Sorry? Yeah, just on that, I mean, you use a term private profit allowed to intervene. That's completely the antithesis of what's envisaged. The Oversight Committee would be headed up by the Secretary General of the Department, involving other government departments. Why? To make sure we implement and make sure that things are practical. I'll give you an example. And there was a furore in the House when NPHET advised that we should enforce into people's homes the numbers on households. Everybody started posing that, saying public liberties, civil liberties, and so on like that. There has to be some filtering of that in terms of how do we make that possible. School transport advice a week to go to the opening of schools came out of the blue from NPHET saying that we should go along with public transport and have 50%. Government couldn't accept that immediately and didn't, but did say we would try and fulfil it over time. Why? Because we've been working with Public Health on protocols for travelling, bringing children safely to schools, the identification of seat numbers for kids and all of that. And so there does need to be some fine-tuning of that from a practical implementation point of view, and coordinating government departments to make sure they're linking in with stakeholders. Thank you, Alaska.